Pneumonia Day. It was first celebrated in 2009 by the Global Coalition Against Child Pneumonia. This year it will be held during a global pandemic that will dramatically increase all-cause pneumonia deaths from COVID-19 and other causes. This year, COVID-19 could add 1.9 million to the death toll that will increase the pneumonia deaths by more than 75%. Pneumonia is the single biggest infectious killer of children and adults. It is a treatable and preventable disease that sickens almost 155 million children and kills 1.6 million each year. The Global Action Plan for Prevention and Control of Pneumonia, released by the WHO and UNICEF, finds that 1 million children's lives could be saved if treatment and prevention innovations were provided widely to the world's poorest countries. Now let's see what pneumonia is. Pneumonia is an inflammatory lung condition caused by infections from bacteria, virus and other microorganisms in which the air sacs or alveoli is filled with fluid or pus and may become solid. It is caused by viral, bacterial or fungal infections and less commonly by microorganisms. The most common pathogen are human rhinovirus, Streptococcus pneumoniae and influenza virus. The identification of the responsible pathogen may be difficult. There are different types of pneumonia. Some of them are bacterial pneumonia. It is caused by bacterial infection and it is the most common type of pneumonia and it can be treated by using antibiotics. Then there is viral pneumonia, which is caused by viral infections. The most common is human rhinovirus. Then there is fungal pneumonia. It is not that common, but it occurs more commonly to those people with weak immune system, such as HIV patients. Then there is parasital pneumonia. It is common in immunodeficient people. The parasites typically enter the body through direct skin contact or ingestion or through insect vectors. Most of the parasites do not specifically affect the lungs, but they involve lungs as secondary to other organs. Then there is a category called as non-infectious pneumonia. It is a class of diffuse lung disease. So diffuse lung disease is a disorder that causes progressive scarring of lung tissue. This includes diffuse alveolar pneumonia and non-specific interstitial pneumonia. Then there is another type of pneumonia called the lipid pneumonia, which is caused due to lipids entering the lungs, and these lipids can either be inhaled or can spread from some other place of the body. The diagnosis is often physical examination. On physical examination, we might see low blood pressure level, low oxygen saturation, high heart rate, and the respiration rate may be faster than normal. Also, using a stethoscope, we can hear crackles over the affected area during inspiration. Then chest x-rays, radiographs, chest CT scans, blood tests, culture of sputum, etc. help us to confirm the diagnosis. The audio you are going to hear is of the crackles that can be heard during inspiration over the affected area using a stethoscope. This is an X-ray image of lungs, which one shows the normal lungs and the other one shows the pneumonia affected lungs. Now let's see the symptoms. The symptoms typically include a combination of cough with phlegm, mucus or pus, fever, chills, fatigue, difficulty in breathing, fatigue, nausea, headache, vomiting, loss of appetite, chest pain, etc. The risk factors include smoking and secondhand smoking, alcohol and drug abuse, living in crowded or polluted conditions, stroke, heart failure, COPD, that is chronic obstructive pulmonary disease, diabetes, kidney disease, allergy, asthma, long-term use of steroids or long-term treatment using steroids, weak immune system, lung disease, HIV or AIDS, cystic fibrosis, and sickle cell disease. Now let's see how we can prevent this. We can prevent this disease by taking flu vaccines. The CDC, that is Center for Disease Control and Prevention, recommends an yearly influenza vaccine for every person who is 6 months and older. Then by using medications and antibiotics, we can cure this disease. Following a healthy lifestyle, quitting smoking, practicing a good hygiene, etc. can help us prevent this disease.